Congresswoman, I want to start our conversation talking about pre-existing conditions.
Yes.
And I want to make sure I get this right. You were diagnosed with supraventricular tachycardia as a child. And you've talked about that pre-existing condition during your work and during your campaign. I want to hear more about that diagnosis and how it shaped your career and perspective on healthcare issues.
When I was in elementary school, I took swimming lessons, as so many suburban kids do. And the day we had to learn how to tread water, I was terrified. And that caused my heart rate to speed up. And literally, it didn't slow down. And that's how I first received the diagnosis. Got out of the pool, went to my physician's office, went to the emergency department, got this diagnosis, all while my heart was racing. And during the time in elementary school and middle school, I had to see a cardiologist quarterly to manage this diagnosis. And the care that I received from those providers really inspired me. So as soon as I learned how to spell pediatric cardiologist, I decided that that's what I wanted to do. Obviously, I ended up picking nursing and having a career in public health and health policy, but my experiences as a patient, my experiences taking care of individuals with pre-existing conditions really fueled a commitment to dedicating my career to helping to improve the lives and well-beings of communities and populations. And so when I finished undergrad and graduate school, I decided to work in policy and had, at the time, my dream job. I got to work to implement the Affordable Care Act and offer, new opportunities for coverage and protections to millions of Americans who had not interacted with our healthcare system before. It was rewarding work and really grounded in this experience that I had as a young person.
I think what we saw after the ACA was passed, especially while Republicans in Congress were trying to repeal it, is that pre-existing conditions and these common sense health issues became really important electoral issues. And how did they push you or motivate you to go from being an administrator to running for office?
So I was actually in the Obama administration for the last couple of years of his term. And when the 2016 election happened, I was surprised like everybody else, but knew that I could not stay in government and help the Trump team take away health care coverage from people. So I decided to return home to Illinois and work for a Medicaid company, continuing forward this work. My congressman had one public event, and during that event, it was during the time that they had all these repeal bills, right? And you remember, each of these bills did slightly different things, and he made a statement, it was his line in the sand, saying that he was not going to support a version of Obamacare repeal that made it more difficult for people with pre-existing conditions to get health care coverage, right? He said, we want people with pre-existing conditions to keep their coverage. Now, I believed him, because he didn't have to say it. He's a Tea Party Republican guy, but I took him at his word. Now, as a patient, right, as a provider, and someone who worked on the ACA, that was really personal to me. So when he went and voted for the American Health Care Act, which is the version of repeal that did the opposite, made it cost prohibitive for folks like me to get coverage, I got mad. Seriously, I got mad and I was like, this is wrong, it's unacceptable, and it's on, I'm running. And I decided to launch a campaign. Now, obviously there's many steps between like spring 17, getting mad and deciding to run, and summer 17, launching a campaign. But my story's not unique, right? There's something that happened for so many people around the country that made them get active. Now, they may not have launched campaigns, but they certainly joined groups. They certainly started making phone calls, writing letters, organizing in their communities. And now we see that healthcare was the unifying feature in all of these races in 2018.
Yeah, I was going to say you were mad for a whole year. That's a lot of anger.
Oh, well, you know what? It's fuel. It's fuel.
Mm-hmm. You represent a district that has never elected somebody as young as you before. It's never elected a black woman to office. Never elected
a woman.
A woman.
Or a person of color. This is Denny Hastert's seat, guys. It's crazy, right?
You were first in several categories.
Yeah.
How do you think that sort of anger you mentioned, that energy around rallying behind something considered the ACA, which lots of people consider to be a really bureaucratic, difficult to understand thing, where does that come from, and how did it move voters to make the decision to elect somebody who's the first of so many different things?
Yes. Well, two things. One, a core value that is shared across my community is that healthcare is a human right. And so people who need access to health care should have it, particularly if they already have it, right? Like, it's so wrong. And I think everybody can understand the idea of someone has diabetes, they should not have their health insurance taken away and then they can't afford their insulin. That is like so clear. And so even if someone is not interacting with the healthcare system, they understand the core principle and the idea of right and wrong, and they're able to relate to this issue of pre-existing conditions. Now, in my district, the 14th, our race at its core was about representation. Did we have a congressman that had our back in this larger chaos and confusion in Washington during the Trump administration? Did we have someone who was literally going to show up for us both at home and in DC? And I think the voters said they didn't. And so I ended up winning by 5 points, and here we are. During our first district work week last week, we had 3 town halls. And I promise you, at these town halls, people came, not because they had a lot of questions, but they were just curious to see what it was going to be like. So literally, we were in Sycamore, Illinois, in this high school. And I say, okay, I give my little opening comments. I'm on these committees. Here's what we're working on in Congress. I want to hear from you. Any questions? And people just start looking around. No, nobody have a question. But they were just surprised, honestly, that you could have an unscripted conversation, you know, unfiltered, meaning you didn't have to write and get screened, and, you know, there's none of these note cards, red and green, and, you know, you could just have a dialogue with your representative. And I think that that level of candor and representation is what people were craving.
How are the Republican voters in your district responding? Are they coming to the town hall meetings? Is this something you see as maybe bridging the partisan divide?
Okay. Healthcare is, in DC, a very partisan issue because there's different ideas. The voter, the patient, the American experience of healthcare is not partisan. You get sick, you need to see a provider. You need to be able to pay for it. And that's something that everyone, I think, has recognized. And so my experience with Republican voters is that they are supportive. I won by 5 points. We had a very unpopular governor in Illinois, Republican, and he won my same district in the same election by 8. So we had a lot of split ticket, cross-party voting in our race. We had a lot of split households, and that's fine. It's great. We can represent all 720,000 people.
So what happens now? You look at the trends, they are not great trends on coverage. You look at people, coverage is declining. Low-income children seem to be losing coverage at some sort of rate. What can you do? What's on your agenda for dealing with those issues in what we expect to be a situation where there will be nothing that passes through both chambers of Congress?
Well, I think that that framework is inherently faulty. I think that there's a lot that could pass through both chambers. My first bill would reverse the Trump administration's moves on short-term limited duration insurance plans, these junk plans that in the Affordable Care Act and the Obama administration, we realized that people need to be able to purchase health care coverage in full faith that they have full coverage. And so we said that these issuers could offer these short-term plans for 90 days as a little bridge. The Trump administration, in their effort to sabotage the ACA and to prop up these plans, promulgated rules to extend those the coverage period for 3 years. That is unacceptable. So now we have people who are purchasing these cheap plans, these junk plans that don't have to cover pre-existing conditions. They don't have to cover the essential health benefits. So they might not cover inpatient healthcare services or maternity services or prescription drug services. And then, God forbid, somebody get a cancer diagnosis or get in a car accident and they are literally screwed. Literally screwed. And so this is a pro-consumer piece of legislation. It's one that really does protect pre-existing conditions, and it has a lot of support by every patient advocacy group, all these associations, right? And I think that it's something that the American public recognizes as a core protection, right? And we need to be fighting to protect their access to health care coverage. And that's something that if it can't move through the Senate, then there's something clearly wrong in that chamber.
On the other hand, I think if you look at how the structures built by the ACA have matured. I think contra lots of the expert opinion, especially when Trump was elected, things like the marketplaces have proven to be really robust and have done what I guess the architects of the ACA wanted to do, and they've kind of faded to the background. They've become regular pieces of everyday life for lots of Americans. Why do you think those structures, things that were really new a couple of years ago and really controversial, have become such an integral part of the healthcare experience and look to continue?
Well, the marketplaces fill the need. We have 37,000 people in the Illinois 14th who have their coverage on the marketplace. And people like choice. People want options. And it gives them the flexibility to take risk in their careers and their lives. If they want to start a business, it's great that they know that this kind of option exists to be able to buy coverage. And I think that there's work that we obviously need to do to lower premium prices, both in the marketplace and in the employer-sponsored market, right? Prices are just rising. There's a lot of really price-sensitive families in my district and across the country. We know prescription drug prices are outrageous, particularly around things like insulin. And we know that there still remain significant coverage gaps. To your prior question, you know, a lot of Americans can't access things like basic mental health care services, right? And so we have a lot of opportunity to fix what we set up with the Affordable Care Act and expand coverage. And so that's what we're tackling in this Congress.
Before my next question, I do want to get everybody ready to ask questions in the audience. And I want to ask about Medicare for All.
Okay.
I want to ask, you campaigned not on Medicare for All, really, but on what you said was a basic right to health care for people. What is your stance on Medicare for All, and how do you feel as a person who came out of the ACA organizing infrastructure, you're related to that?
ACA implementing infrastructure. You know, I don't want to take away from the brilliant organizers around the country who do all kinds of good work. Here's what I believe. Healthcare is a human right that's been foundational to my nursing practice. And I think it's fantastic as a country that we are having this conversation about how do we offer coverage to as many people as possible at a rate that's affordable and accessible in their communities. That is wonderful. That is where we need to be going. Now, when I ask people what they mean by Medicare for All, and generally in my community, they'll say single payer Medicare for all, and they'll say it very quickly, right? And they combine all these things together. Well, what do you mean? They say Medicare 55 and up, Medicare 40 and up, Medicare 18 and up, Medicare at birth. And then some people say, oh, I just want to buy into Medicare. Well, those 5 things are incredibly different, and they would have far-reaching implications in our system. And so where we are right now, in my perspective, is trying to decide as a country, as activists, as advocates, what do we want? It is not my job to tell people what they should want, right? I want to hear from them. And then we need to know how much it's going to cost and how we pay for it. Because my district is one of these, you know, upper middle class communities. The average household income average is $105,000 a year. So we know that any change to the tax system is going to impact these folks directly. And so I would not be doing my job and due diligence without asking those really important questions. And so I am not here to block progress. I'm not here to be antagonistic. But I do want us to have an open, honest conversation about the impacts of these policies and how it would transform our healthcare system. But I think that the underlying goal is one that I wholeheartedly agree with, and I'm ready to discuss the nuances of the policy.
So I do want to find one really good question.
Really good.
Really good, right there.
Now the pressure's on. Thank you for being here. My name is Darren with the College of American Pathologists, and I hope this is a good question, but it's on surprise billing in particular. Yeah. And do you think this is something that there are discussions happening now in the House? Do you think this is something that could get bipartisan support to move?
Yes. The short answer is yes. The challenge is that there's a lot of these challenges, right? Like ambulance care, these ER visits. People who have coverage have what they would consider to be good coverage that they are sacrificing by paying their premium every month. And then one thing happens. one thing happens and it can lead to financial catastrophe. And there's no transparency, there's no accountability unless you're lucky enough to have a great reporter like Van or like, you know, some of these other places to dig into why your billing happened the way it did. There's no relief for people. And so in the vein of these pro-consumer moves, I think that it's something that's very attractive for this Congress to address. But there's a lot of competition even in the healthcare space, right? Because, you know, if we're going to tackle any one thing, do we do premium prices? Do we do prescription drugs? Do we do surprise billing? Do we do mental health? Do we do opioids again? Right? Like, there's so much that we could do in sort of a limited amount of time to get it done. But I'm here for whoever wants to work on that issue.
So I do want to follow up very quickly on that question with one of my own, which is you talk about the impacts things like surprise billing have on family finances. What are the ways you can work on the wraparound, the other issues involving poverty and household income that affect this?
Yes. So we know that the social determinants of health are cross-cutting, widespread, and that's really one of the things I'm most excited about. So you know that Chairwoman Maxine Waters is running financial services now, right? And in there, she's talking about homelessness and housing insecurity. And that's really important and one that most people don't consider having healthcare impacts. But if you're willing to have that kind of upfront conversation, that opens the door to, well, how does Medicaid maybe intersect with housing, right? How do minority communities who can't access lending and banking, right, have stability, and what is the impact on their healthcare? The evidence-based research is rich. We know the solutions in the healthcare space. It's the policymaking that hasn't caught up. And so I'm encouraged that in this Congress, we have leadership who are willing to take an expansive view in their jurisdiction, and we're going to be able to move forward on a lot of these social determinants without having it be an explicit healthcare conversation. So I would say, take a look at what other folks are doing in their committees. And knowing what you know about healthcare and what I know about healthcare and what all of you know about healthcare, let's talk in 5 years and see what's changed. But even if they're not coming to this stage to talk about it in a healthcare context, we know there's an opportunity for widespread impact.
Well, I want to thank you, sir, for your brilliant question. Thank you all for attending, and thank you, Congresswoman.
Bye, thank you.